Good morning, everyone from in the different part of the world. And actually, I ever been in the epidemiologist and in the division of epidemiology, Department of Disease Control. And now I'm director of Office of International Cooperation at the Department of Disease Control as well. So today, I will spend maybe like around in the 20 minutes to give you some idea about in the for the first one is outline situation and policy, and then I'm gonna talk about in the measure and prevention for in the COVID-19 in Thailand, and what in the we learn from this outbreak, and what thing will be changed after in the COVID-19 emerge in our country. Next, it will be in the situation. Okay, this is kind of like the world situation. And in Thailand, you can see from the map in the left side, in the left-hand side. This show that like the cumulative confirmed cases that in the focus in the part of in the Asia. And in Thailand, we have like a yellow color. That's meaning that we have some like the case between 1,000 to 5,000 cases. And for the next slide, I will show you about in what in the cases that we can detect in Thailand. But for in the length, and now in Thailand, we are in the length of in the 113. That means that we have in the world for in the all the number of cases around the world. And for the next, okay, this is the situation. We have this kind of dashboard that show on in the over the website. We have in the website that developed it for in the report of the COVID-19, and we also have recording the special announcement and the daily situation that we distribute to the broader audience is for the general population, for in the international, for in the foreign country. That means they can learn what's going on in Thailand today. That is good news that we don't have any cases that in the report to in the our system. That's meaning the zero case. And you can see from in the for the total of in the new confirmed cases in Thailand, we have in the 3,381 cases and 72.3%. This is the we call local transmission. What does mean local transmission? That's meaning that we use the mechanism, we use the tool that we call in the investigation tool. When we found the case, we have in the contact tracing, and we investigate the case to find the source of in the source of in the infection. And if the infection that occur in Thailand within the country, that's mean we call in the local transmission. So far in the all in the total cases are 73%, around the 70 to 73%. That is the source of origin is within the country. But for in the around in the approximate are 30%, this is an imported case. What is an imported case? That's meaning the when the people alive in Thailand is we are in the ground crossing or from in the air crossing. This is from the flight. We have to detect them at the airport or in the point of entry, and then we send them to the quarantine area. So when we tested and found that the confirmed cases, we can be confident that this is a case is not occur in the domestic in the domestic area, but that occur in the patient, then they travel from the outside the country. That's why that we have in the imported case around in the 937 cases. And now we have in the 58 cases with 58 days from in the 3,000 cases. So it means that uh, case fatality rate, this is around in the 1.7 or 72%. It's quite low, even the compared to in the average of in the world situation. This is just only like a 2%. Okay, that is a great news for our country. Okay, and for the next one, this is kind of like the graph that show how we can, what this is like to give you just like a whole picture, what in the situation in Thailand. Okay, I think that you can see from the graph that in the we climb up to the peak of in the cases of COVID-19 at in the beginning of April. But when we declare about in the close the air border, that means in the we didn't allow any in the flight, any in the airplane to come to Thailand. You can see that it's quite like a significant signal that in the can interrupt the cycle of in the transmission in our country. The peak is quite like a dramatically slow down, and now in the following the after in the we cross the air border, and you can see that we have some like a sporadic cases that occur until from in April to up to like now. This kind of most of cases that's from in the quarantine that we can detect that at in the quarantine area. So the main proportion, like the big proportion of in the cases that we detected after we cross the air border is from in the outside of the country. Okay, next. This is okay. You can see from the picture. Okay, when we see that, okay, how we can cope the disease outbreak in our country, we using the many methods. We we implement many the control measure. That is great. That in our policy maker, uh, they they pray with us. They're very concerned. Then they are in the we have in the meeting every day, and we talk about in the how we can release, we can deliver any message, and how we can translate our message, key message to the people. And you can see from the picture when in the because in the people need to eat, and when they have to go to like a food state, right? We ask all in the food state owner, the owner of the food state to provide kind of like the partition that separate the people to eat together, because in the, we would like to prevent the spreading of the disease in the saliva or in the like a from sneezing or coughing. This is something that in the we ask the people, the owner, to prepare for this. Okay, and this is kind of like the picture and see and show you what in the main important measures. I, I think that you can see the keywords is a multilateral cooperation. Okay, it means that we cannot do by ourselves. That's from in the health sector, but we need to engage, to encourage all in the non-health sector and also communities and foreign the NGO, the private partnership to join with us to reduce the impact of the COVID-19. Find the first picture, and in the left-hand side, you can see that like our officer, public health officer, we train the people how to collect the samples from the arrival passenger at the airport, at in the ground crossing, and also we set like a screening test, the rapid test that the people can drive through and can get the sample and to be tested for the COVID-19. This is it is fine. We did it very well because in the we can expand this station throughout the country, but we need to do more in the future. That in the maybe in the around in the cross border area, we have to strengthen our officers to do more things about this kind of like active case finding. And from in the middle picture, you can see that in the this is from the supply chain. That means we try to keep the distance between the people. Okay, and this is a good thing that in the we got very good collaboration from the private partner. That means that in the or in the like a SkyTrain, the public transportation, they implement this measure to keep the distance the people when they use the service of in the public transportation. And for in the last picture, this is happen in the barbershop. Okay, because we know that we cannot stop, we cannot ask all in the owner or in the business person to close their job. It's hard for doing that, but we ask them to do some like a measure, and we make it this measure it's in the easy way. That means for the general people can understand. That means we make the measure in like an infographic and we put the measure in the term of in the comics and also ask in the for the NGO and the private partnership to make in the like in the printing that in the a lot of people can understand. And this is kind of like a I think that it is for this picture we already enter into in the phase two of in the relaxing measure, and then the phase one we very like a intensive measure. Okay, we course there a lot of shop, we course in there many in the public places. But the phase two, when we like are confident that we can control the situation, we implement relaxing measure. That means in the barber shop, everyone when they go to the barber shop, they have to like wear the mask and they have to like use in the application to track okay that in the okay they register and they pay. If when they have support in the confirmed cases what detected, that means we can trace back how many people and who use that service during that time. It's easy for us for in the doing the contact tracing. Okay, I think this kind of like this slide this can capture what strategy that we use for managing of the COVID-19. We use in the abbreviation C. That means we have 6C. Okay, for the first C is the capture. Capture, capture abnormal event. Early detection, add in the point of entry. This is a keyword for us. Even though we can detect the abnormal event or the suspected COVID-19 at the earliest phase. That means we can make it in the quicker, smaller response, smaller outbreak. That is our keyword. For in the second C is a case management. Because in our goal, we want to like we want to decrease the case mortality rate as much as possible. So our doctor, our our nurses are in the after in the healthcare officer, healthcare worker have to learn how to manage the case of COVID-19, and they have to learn how to protect themselves from to be infected from the COVID-19 patient as well. This is we develop a lot of guidelines and we distribute to in the other hospital. That's been from in the government hospital and also private hospital as well. For in the third C, contact tracing. This is so important too for in the epidemiological investigation. Because when we have got the report of in the confirmed cases, the contact tracing this is help us to know and now how many like what is the burden of this outbreak and how many persons can be the high risk contact or the low risk contact, and when we can trace them, that means we can get the people that we call the high risk contact to be in the our quarantine site and just like try to cope up in the transmission, try to break out the cycle of transmission. So this is the third C, this is contact tracing. And the fourth C is a communication. Communication. This is some people call the rich communication. This is a quite essential tool to talk with the people to understand how the government implement the measure. What is the reason why we have to ask the people to wear the mask every time when we go outside of their home or their residence? Why they have to like frequently washing their hands and a lot of things that in the we transfer the message to the people while using the channel of communication. And now this is a picture, this is like a spokesperson that in they talk with the people every day. Okay, and so in the just not only like a official communication, as you know that, and now in the globalization, in the we use internet a lot, as meaning that we approach communication with the channel of in the social communication, just like a messenger or line application. So in the we have like a chatbot and also website That means a lot of channel that we use it to access info to ask the people can access the information. And for in the fifth C, this is community participation. In Thailand, before the outbreak of the COVID-19, we have the health volunteer. The health volunteer is kind of like the people that work in the village, and they help us to talk with the people in the village level. And also when they found something wrong that happened in the community, they report to our public health officer. So the health volunteer is a fight is very important person that help us in a lot of things in the term of in the contain the disease. And the last thing, coordination and information. This is we cannot work by ourselves. We have to work within the different ministry, just like a Ministry of Foreign Affairs, Ministry of Defense, Ministry of Finance, and also within the academic institute. That means that we have to work together. We share some in the essential information and a lot of information. This is kind of like a success strategy how we can manage the COVID-19. And this is a picture for the next one. This is a picture that in the title like conclude what how we can strengthen our in the system. Okay, this is for in the first station. We screen the people from in the outside of the country. That means the capture. We try to capture the people from in the at the point of entry. And at the end, we cannot quarantine. This is 100% that we can detect all the abnormal events at in the point of entry. Maybe some people they believe from that station, and when they have like a show clinical sign, and when they go to the hospital, that means the people in the like medical doctor, nurses, or the healthcare worker, they know what is the case definition for in the abnormal event, the case definition for in the patient under investigation of COVID-19. They help us to report. And then for in the last station, this is communities. As I told you that in the we have in the health volunteer. So the community, we ask the health volunteer to help us to be in the implement the surveillance, to be report any something wrong that happened in community to the upper level. And this is show you that in the it's another picture that show you how we can detect COVID-19 and how we can cope the problem from the COVID-19. And you can see the word that we call EOC. EOC is from Emerging Operation Center. This is the EOC. They combine all the sector and combine all information and synthesize, analyze, synthesize the data, and serve to in our policymaker to make a decision what in the important decision thing that we have to implement to the general population. And for the next one, this is a laboratory capacity. We have to thank all like the Department of Medical Science and the university on the academic institute to help together to strengthen up in the laboratory capacity. And now in Thailand and in Bangkok, we we can guarantee that okay, even we can test for in the suspected of in the COVID-19 10,000 samples per day. And you can see from the picture, you can see the red dot. It is kind of like the laboratory station that they can test for in the COVID-19. And you can see that this is the laboratory capacity that is covered throughout the country. And now we have around in the 200 laboratories that can test for the COVID-19. Okay, and okay, I think that everyone concerned about in the second wave. Okay, because in the situation change every time, change over time. So we have to develop strategy to prepare and respond if in the second wave may be occur in our country. And we can say that we have like a 5 new strategy. For the first one, quarantine, Q. Q, this is quarantine. This is I think that everyone acknowledge that quarantine is an important tool to contain the disease. That means that we plan to expand in Thailand, and now we have in the state quarantine. But in the most of state quarantine located in Bangkok. But for the next phase, we try to expand like a local quarantine in other provinces, and we try to provide like an alternative state quarantine for foreigners that in the evening that they have the pocket, they have some money, they can pay for that. And also we try to develop in the organizational quarantine. That means we try to develop in the different kind of quarantine. Okay. Find the next strategy is the testing okay, as you know that in the because the COVID-19 can be confirmed by the laboratory method. So we have to expand more um, laboratory testing, and we have to develop the new innovation of the laboratory, how we can test in the COVID-19 in the fastest way, and how we can develop in the screening test, maybe how about in the antigen testing or antibody testing. For the other T, this is tracing. Okay, contact tracing. This is we have to train our investigation officer how to trace the people, how to get more information if in the some like in the case or the confirmed case that occur in community, how we can test how many like high risk exposure or the low risk exposure. For the another strategy we call isolation. Okay, when we found in the confirmed cases, we have to bring them into the isolation area because in the we want to interrupt in the transmission of the disease. So isolation is will be very important. Find the last Q, quarantine as well. You may wonder why is this we have in the two quarantines. What? Okay, for the last quarantine, this here is a different quarantine from in the first one. Because it's a quarantine, after in the we doing the implement the contact tracing, and we know who's gonna be the high risk exposure. Okay, we and in the I think in the past experiences, we just ask in the high risk exposure stay at their home. It's like a home quarantine. But sometimes it's hard to control that all the people of the high risk exposure they stay in their home. That means we try to develop quarantine for the high risk exposure. Okay, this is the final strategy that we would like to further development to manage the second wave. Okay, and what Thailand went well. I think this far in the this is okay in the last month. We have in the it's called like after action review. It's called we ask for the external review to look see what in the happen in our country. Okay, this is from external reviewer. They said about in the experience of in the Thailand. Fire. Okay, in the you can see from in the extent. I think in the keywords that you can see from the slide is kind of like a cooperation. In Thailand, I think we have a good cooperation. It's from in the health village volunteer. We have in the very good network of that. And also we have in the EOC that in the we cooperate from in the different sector to do together on in the surveillance, on in the investigation, on in the strengthening of in the laboratory. And also, and the last one is very important. We have broad enforcement. This is a COVID-19 show us how important even though we can implement the law enforcement to contain the disease. And also we just not only law from in the health sector, but in the we use in the various law from in the different sector. We combine that and use that the law to contain the disease. Okay, next, what will be changed? Okay, I think the picture can tell you all the things. For in this picture, you can see okay, for in the back to in the slide monk. Okay, the monk have to be like a face shield, right? When in the morning, this is a we never seen like this before in Thailand. And for the next, okay, we still have to do more on in the early detection. It can be like a temperature, checking temperature, and train the people at in the point of entry how to screen the passenger when they pass on in the different in the crossing area. Okay, for the next, okay, this is a portable. This is a picture of in the portable PCR. Okay, we have to develop in terms of innovation of in the laboratory capacity to do in the faster, to do in the more varied for test on in the any samples. And you can see from in the hotel, okay, in the hotel, and even if the people would like to enter to the hotel, that means they have to show, they have to check in, they have to like give more information. What will they go? Okay, and where will they have to like meet or appointment within the other people, and they have to register in the our online system. Okay, this is the change. And also at the health control at the border, okay, we set in the people, I think the same within the, we try to strengthen our in the officer at the point of entries. And also we have to work very close within the immigration center, because in the we cannot work alone. We have to use data information from in the Bureau of Immigration, and it's just not only in the Bureau of Immigration, but the information from in the Ministry of Foreign Affairs. We have to integrate all the database together, and you can see that the picture of like the meeting. It's the meeting. It's just not only health sector, but we have the meeting within the among in the various organizations, both in the private sector and also within the international organization, because we have to think together. Okay, this is I think for the next we cannot work alone. And also mask and checking temperature for screening. It will be like the must thing that we have to do in our places. And also we have to maintain the momentum of in the keep distancing and in the public place. Okay, we still in the ask the people to keep distancing and avoid for like a social gathering. And also you can see that like a QR code. Okay, this is the online application. Okay, we have to do more invest to do like a further investment about in the online system and maybe in the telemedicine in the future. And we have to use a lot of things about in the internet. So I think that this cover the change that we is maybe it's hard to be back that in the we ever do in the past. So we have to like make it understand, and we have to ask the people to cooperate with us for the new, we call new normal in Thailand. Okay, that is a fall on in the situation and the measure, and you can see what in the future that will be occur in Thailand. Okay, thank you very much for listen to me and listen to in the our protocol on the measurement that we plan to do in Thailand. Okay, it's feel free to have any question. Okay, thank you very much.